His work focuses on the co-epidemics of depression and HIV and the development of scaled-up approaches to the integrated treatment of these critical public health problems. His research has already made a difference in South Africa, and he will, no doubt, make a difference to the public health of communities around the world. He joins us today to celebrate your accomplishments.
Good morning, everyone. Wow, there's a lot of you. So dearest graduates, family, friends, and members of the School of Public Health community, it is a real privilege to speak in front of you today. I'm sure that none of us graduates would be here without the love and support of those who mean the most to us. We are who we are because of them. Therefore, I would like to start by asking my fellow graduates to join me in expressing our gratitude to those who helped us get here today, whether they're here in person or here in spirit. Thanks. So, I've devoted my time at the University of Washington to the study of implementation, which is really the process of getting things that work to the people who need them the most. In our field, we talk a lot about something called the know-do gap. It's the space between what we know and what we know how to do. We have effective clinical and preventive interventions that can save lives and alleviate disability, yet dramatic disparities in quality and coverage persist all over the world. A whole science is now dedicated to solving this problem, and an immense amount of thought is going into understanding barriers to implementation of effective interventions and improving strategies for delivery of essential interventions. And wouldn't it be wonderful if there was some perfect solution, some model, some dashboard, some app that could bridge the know-do gap and eliminate health disparities around the world? The science of implementation tends to be complex, it tends to be fancy, it tends to be technical, and as a student of the science, I can tell you that it's intimidating. Yet I believe the fundamental truth is neither complex, nor fancy, nor technical. The science of implementation brings us back, inevitably, to something that we've all known all along. It's about people. To get things that work to the people who need them the most, to get people to deliver effective interventions and health services around the world, we must invest in people. There is no easy road to narrowing the know-do gap. There are no shortcuts. I do not think it will be cheap. Apps, dashboards, and models are helpful, but the big win will only come from meaningful investment in the people with whom we work. From building and cultivating long, deep, trusting collaborations and meaningful community ties, from offering substantive opportunities for personal and professional growth and hope for the future, from building a culture of kindness, interconnectedness, and support, one in which we care for each other in our roles and recognize our achievements. I believe this same lesson applies now to all of us as we graduate from these programs and as we move forward in our work. By all means, let's think big and let's look for smart solutions. But let's also not forget to do the hard work of remembering the people who came before us, investing in the people around us, and building up the people who come after us. Think big, but also think small. It's not always about the complex, the fancy, or the technical. Cultivate meaningful relationships, nurture community, and share the wealth. I'd like to end with a proverb that's been bouncing around my head for the last few weeks. This proverb comes from New Zealand, which also happens to be where my family comes from. In the language of New Zealand's indigenous people, and please forgive me for the pronunciation, although I am Kiwi, I was raised in Connecticut. He aha te mea nui o te ao, he tangata, he tangata, he tangata. What is the most important thing in the world? It is people, it is people, it is people. Thank you very much.